SSDI benefits, but more specifically about and around the back to work incentives. So we're going to give everybody just a couple of minutes to join us. Right now we have about 30 people online, and we're at, I believe, 78 this morning. So we're just going to give everybody 1 or 2 more minutes before we get into this. Mandy, can you mute your microphone until we're ready for you? I'm just getting a little bit of feedback from you.
Here we go.
No problem. Hello, everybody. This is Chris Lindenberger again with the Texas Homeless Network, and I wanted to welcome you guys to the May Bloc webinar, or the webinar we're calling the Bloc webinar, which just really speaks to best practices around the state of Texas when working with clients that struggle and that are experiencing homelessness. So if you remember in the past, we have had individuals on around specific coalition efforts, building resources, as well as our coordinated assessment piece and coordinated intake. And then back towards the beginning, we actually had Pam Hine come on and speak around our SOAR mental health piece that THN uses or implements around the state when working with clients that are struggling with disabilities. So today we are pleased to have Mandy Lomax with us, and she is local here in Austin with us, but she really does a great job for us in getting out to Central Texas and talking about SSI and SSDI, but also more specifically about the back to work incentives. However, before we get Mandy on the line, I do want to go through a couple of housekeeping pieces. As soon as I can get my computer to work. Oh, so just the agenda for today, we will go over the presentation. So Mandy is going to give us a presentation around SSI and SSDI, and more specifically, after we are finished working with client, not finished, but after we help a client get the resources they need, really getting them back to the community, and what some of those back to work incentive pieces look like. Then during her presentation, you guys can submit questions. There is a question piece over to your right, or a question, a little module over to your right with the big arrow. And so you can click on there for a question. You can submit your questions, and then during the presentation, we will kind of pick out some of those questions you guys have for us and for Mandy, and then at the end we will I'll ask those of her so that she can answer them. Mandy will be joining us by conference call today, so I will be actually working the PowerPoint for her. So everything should be fine, but hopefully I won't get behind on a slide or so. And then just keep in mind that your microphone will be muted the whole time during this webinar. This is to help reduce feedback that we get. If everybody's allowed to talk, then everybody's talking over each other. And we really want to be able to hear our presenters during this webinar, especially if we have 40, 50, 60 people on the call. So, and then as well as we will be recording this webinar after we get done today. Craig will send it out via the THN web address, and we will get it to everybody so they can review it. Or if you signed up for it and you did not get a chance to click on it, it'll pop up in your inbox. So really today, as we go out, we are working with clients around disability, and as I mentioned at THN, we do a whole training around the SOAR curriculum, which really focuses on working with clients and effectively getting them the resources they need so that they can be stabilized. Because we know that if a client is stabilized and has housing, we can get them the medications they need and the case management support that they need, and keep them safe. And so, as we talked earlier around SOAR and kind of the process of working with the client around disability, we also have to think to the other side, which is when we are done working with, not done working with client, but once we get them our disability and we get these resources, how do we get them implemented back out in the community? How do we get them working again? How do we get them engaged? Because we know that this is a positive piece or this can be a positive thing for them to get them back out there in some kind of capacity, working or volunteering. So Mandy is going to speak to that, but she's also going to speak to just some general SSI and SSDI pieces to kind of refamiliarize everybody as well. So without any further ado, I would like to introduce Mandy, and I will switch over to her PowerPoint. You there?
I'm here. Are you ready?
I am ready.
All right. Well, good afternoon, everyone. I am going to give you a very brief overview of just all the benefits available through Social Security, which includes retirement, survivors, etc. And the very first slide should be showing Social Security and then a web address, www.socialsecurity.gov. And everything I'm going to be talking about today, you can go to that website and find confirmation or find additional information. And one thing that may not be included in any of these slides is the Social Security 1-800 number. And I'm just going to say that to you if you want to write it down. It's 1-800-772-1213. So we would hope that you could go to our website to find all the answers you need, but the next step would then be calling the 1-800 number. 1-800-772-1213. So let's move to the second slide, and that's showing just a picture of what our homepage looks like. And on the bottom left, you'll see My Social Security with a little lock. And I wanted you to have a visual because we really encourage you to sit down with your clients and have them go and create an account with My Social Security. If they don't want to do that, the very next item is online services. If they need a benefit verification letter, instead of them coming into the office, you want to help them do this online. And we have a change coming up October the 1st of this year. You will no longer be able to walk into the Social Security office and get a benefit verification letter. The only way to get a benefit verification letter is to go online, either via My Social Security, creating an account, or by clicking on online services, or by calling the 1-800 number that I just gave you. And that starts October 1st, so I wanted to highlight that for all of you. Moving on to slide number 3, it's just the history of Social Security benefits. This is just because it's interesting. If you kind of wondered how this came to be when it started in 1935, which is retirement, and they added survivors in 39, disability, was not part of the program until 1956. Medicare came in 65, and SSI wasn't in the picture until 72. So it's kind of interesting to see that evolution of Social Security. And moving to the next slide is a picture of the first Social Security office. And oddly enough, that was right here in Austin, Texas, on 6th and Colorado in 1936. So once again, just an interesting little piece of history for you. Let's move on to the next slide. And that slide should have a heading of how do you qualify for retirement benefits. And this touches everybody, which can also touch your clients. The first bullet, you need to work and pay into Social Security, have enough credits. And generally that's 10 years of work where you've worked enough and paid in to earn all 4 credits or quarters each year. And this year, to earn 1 quarter or 1 credit, you have to earn $1,200. And the maximum, of course, is 4 a year. And the example at the bottom gives you an example for this year. To earn 4 credits in 2014, you must earn at least $4,800. And let's move to the next slide. Heading is your age at the time you elect retirement benefits affects the amount. Well, first of all, if you have a client who is age 62, they can come in and file for retirement benefits. It will be reduced, but at least they will have some kind of benefit coming in. So they wouldn't have to be disabled at that point. So the example given for age 66 and age 70, this is for people born between 1943 and 1954. And the next slide I'll show you will be a full retirement age chart. Years ago, full retirement age, meaning when you could get 100% of your Social Security benefit, was at 65. Well, they changed that, and now it's graduated. It's based on your year of birth. So for those born between 43 and 54, age 66 is the point at which you can get 100% of what you are eligible for based on what you paid in. If you filed at 62, it would be only 75%. And if you wait until 70, you get extra called delayed retirement credit for each month you delay filing for Social Security up to the age of 70, and that can come out to about 132%. So let's move to the next slide, which is an example of the full retirement ages. So you can see that the latest full retirement age is for individuals born 1960 or later, and age 67 would be the age at which they could draw 100% of what they're eligible for based on what they paid in. Now, they can still file at age 62. It's just going to be a reduced benefit. Moving on to the next slide, the heading is, in addition to the retiree, who else can get benefits? And your child can, if they're under age 18 and not married, or if they're still in high school under the age of 19. Your child can also draw on your record if they are disabled before the age of 22 and not married. Your spouse can draw on your record at age 62 or older, or at any age if caring for a child under the age of 16 or a child who's disabled. And an ex-spouse, a divorced spouse, is also eligible if the marriage lasted for a duration of 10 years. And of course, a divorced spouse drawing on a record does not affect a current spousal benefit. Let's move on to the next slide, which is a heading of who can get survivor benefits, meaning if you pass away, who can draw on your record. Well, your child can if they are not married and under the age of 18, or if they're still in high school under the age of 19, or if they are disabled before the age of 22 and not married. And then, of course, your widow or widower can draw on your record. And if they're full retirement age, which for most individuals right now retiring is 66, they could get 100%. They can draw a widower's benefit as early as age 60. It's about 71.5% at that point. If the widow or widower is disabled, then they can file as early as age 50, or at any age if caring for a child under 16 or a disabled child. And if an individual or widow or widower remarries, it won't affect benefits if the remarriage is after the age of 60 or if they're disabled after the age of 50. Divorced widows and widowers may also qualify. And the last bullet there is a lump sum death payment, which is payable to a surviving living with spouse. And it's just $255. If any of you have experienced having to deal with funeral expenses, you know that doesn't cover even a tiny portion of those expenses, but that's what it's been for years and years and years, and I don't see them changing it. So as I'm listening to myself read all this out, I'm flying through this, and I know that there's a lot of questions that may be coming up. Most of your questions can be answered by going to our website and just clicking on the Survivor tab or the Disabled tab or the Retirement tab, and it'll give you a slower, easy-to-read version of what we're covering today. Well, moving to the next slide, who can get Medicare? Well, Medicare is available if you're 65 years old or older, or after 24 months of entitlement to Social Security disability benefits. If you have ALS, you do not have to wait the 24 months. And if you have permanent kidney failure, then Medicare is immediately available. There's some rules around that, but you don't have to wait 24 months for that either. The next slide heading is when can I sign up for Medicare Part D? And there are specific Medicare enrollment periods. The initial enrollment period is at age 65, 3 months before or 3 months after. And so even if you're planning or you're talking to one of your clients and they happen to want to wait to file for actual benefits, you still want to contact Social Security either online, file online for this, or by calling our 1-800 number to file for Medicare 3 months before the month of 65 or 3 months after to get signed up. There's a special enrollment period. If you're continuing to work and covered by your employer's group health insurance, you can wait on the Part B until you're no longer working. And then there's a general enrollment period, which is January through March of each year. And if you sign up in the general enrollment period, coverage is not effective until July of that year. Okay, moving on to the next slide. I'm not going to go over the details of Medicare coverage. I just wanted it to be available within this webinar for reference to see what Part A covers, which is hospitalization, and that's free for most individuals who are insured for benefits. The Part B is the medical insurance. It does have a Medicare premium, which this year is $104.90. And individuals that have really high incomes, that may be a little bit more. Part C is the Medicare Advantage plan, and then Part D is the Medicare prescription drug coverage. So that's just a very brief overview of the Medicare available. Moving on to the next slide, we're getting closer to what you're really wanting to hear today. Who can get disability benefits? And the worker, the individual who has worked and paid into Social Security, they have to have paid in generally at least 5 out of the last 10 years. Now, if you are a younger worker or one of your clients is younger, under the age of 31, then fewer years are needed. And the best thing to do is simply help them file online or have them call the 1-800 number to get an appointment to sign up if you're not sure if they're insured or not. And moving on to the next slide, what is the definition of disability? Well, Social Security's definition is a medical condition or a combination of impairments preventing substantial work for at least 12 months or expected to result in death. And this decision, that they do take into consideration age, education, and work experience in determining if the impairment is severe enough that the individual could not do any kind of substantial work. Moving on to the next slide, who can get benefits on a disability record? If you have a client that is receiving disability, can any of their family members get benefits? And the answer is yes. A child, if they're under the age of 18 and not married can draw, or if the child is still in high school, under the age of 19, or a disabled child who became disabled before the age of 22 who is not married. A spouse also could be eligible on your disability record at the age of 62 or at any age if caring for a child under 16 or a disabled child. Moving on to the next slide, we are now moving away from Social Security benefits and are now talking about Supplemental Security Income, SSI. And SSI is not a Social Security benefit. It does not come out of the trust fund. It comes out of the General Treasury. And it's for individuals who are 65 or older, or who are blind or disabled, who have limited income and limited resources. And there's a little bullet at the bottom indicating that non-citizens must meet special requirements to qualify. And I'm not going to be covering that today, but it is on our website. So for SSI, you have to be living in the country, residing in the country, and you have to be legal to be eligible. The next slide is a comparison of Social Security Disability, acronym is SSDI, and Supplemental Security Income Disability, acronym of SSI. And they are both disability benefits, but this kind of side-by-side look kind of shows you the differences. On the left-hand side, Social Security, it's based on work. On the other side, SSI is based on need. SSDI, you have to be insured, meaning you have to have paid in to Social Security by working. SSI, on the other hand, if you've never worked, you could still qualify if you have limited income and limited resources. SSDI, the actual check amount is based on an individual's earnings over their working lifetime. SSI has a maximum and is based on your income, and the maximum this year is $721. And the resource limit for an individual is $2,000. For a couple is $3,000. I should have mentioned that earlier. The fourth item there under Social Security Disability is that Medicare comes with Social Security Disability after 24 months of entitlement. Under SSI, it's Medicaid, and Medicaid is effective the first month of entitlement to SSI. The last item there, the fifth item on both sides, if you don't know what your client's receiving and they don't know, they can't tell you, they just know they get disability, then finding out what day of the month they get the check may help you. Social Security checks are paid on the 3rd of the month or on the 2nd, 3rd, or 4th Wednesdays. SSI, on the other hand, is paid on the 1st day of the month. So if they tell you they get their check on the 1st, you know that's SSI. Basically, any other day of the month, you know, oh, that's Social Security. So that will help you. Moving on to the next slide, how do you help them apply for either retirement or disability? And the first recommendation is that you help them apply online at our website. The second option is to call our 1-800 number, and it is in the slide, so I'm glad to see it there visually so that you've got that in the notes. And you can schedule an appointment to apply through the 1-800 number. And the next slide shows you how to apply, just kind of a visual of how to go in. You would go to socialsecurity.gov and click on benefits, and there are several ways to kind of navigate the website, but that's probably the easiest. Click on benefits. And then the next slide, oh, I guess we didn't go any further than that. All we're doing is getting you started. So that's just going to get you in, and it's fairly user-friendly. You just follow the prompts to apply, whether it's retirement or disability or Medicare. A little side note here, if you are having a client file for SSI, you can still file for Social Security Disability online with them, help them do that. But then you will need to set up an appointment for SSI, and the online application for Social Security Disability will give you that prompt and reminder to do so. That automation or online service is coming down the road, but we don't have the SSI application online yet. So moving on to the next slide, the heading is Retirement Survivor Benefits. You can work and still receive benefits. So I'm kind of jumping off disability really quickly to just let you know or have a reminder that if you have a client who's getting retirement or survivor benefits, they have an earnings limit, which is different than how earnings affect disability, which we're going to talk about in more depth next. And the best thing to highlight there is under full retirement age. If you are under full retirement age, meaning maybe filing right at 62, this year they can make up to $15,480 in a year and still get all of their retirement benefits. If they start to go over that amount, earn over $15,480, then for every dollar they earn over it, we hold back, I'm sorry, every $2 they earn over that, we hold back $1 of benefits. And if they're full retirement age, then there's no limit at all. So a lot of individuals, as far as friends and relatives that you're talking to and advising, they sometimes will want to wait until full retirement age so they can continue to work and receive their full benefit. Moving on to the next slide is getting into what you really need to know today about work incentives. These back-to-work initiatives, how to help individuals who are going back to work and the impact on benefits. And we're going to start out talking about the impact on Social Security disability. And the answer is different if it's Social Security disability or SSI disability. So keep that in mind. So talking about Social Security disability first, the first thing you need to know is that there is a 9-month trial work period. And this allows an individual to go back to work and try to work without their check being affected at all. That means that they can earn any amount of money, $1 million a day, and for this 9-month period, still get their full Social Security disability check each month. And if they're just working a little bit, maybe earning $100 a month, that's not going to count as a trial work month. This year, what counts is any earnings over $770 a month. Or if they're self-employed, if they work more than 80 hours in a month, that could be considered a trial work month. And these 9 months do not have to be consecutive. They may try to work this month and then have to stop and don't go back to work till next year, and work 2 or 3 months and then have to stop and not go back to work for the next year. So we count them or accumulate them in a 5-year or 60-month time frame. So we can accumulate and they don't have to be consecutive. So after a person has gone to work and worked for 9 months and used their 9-month trial work period, then they have, number 2, the extended period of eligibility. And this is a 36-month period or a 3-year period in which an individual can try to work, and it's kind of a safety net. If they earn substantial earnings, what's called substantial gainful activity, they would not get their check that month. If the next month they are under that limit, then they would get their full check. It can go on and off for this 36-month period. And this year, substantial earnings are defined as earnings over $1,070 a month, or if the individual is statutorily blind, earnings over $1,800 a month. And that these figures usually change if there's a cost of living adjustment each year. And it is over, if they earned exactly $1,070, it's not substantial. If it's a penny over $1,070, then it would affect their check. Third item, continuation of Medicare. Sometimes this is the most important piece of their return to work plan. Medicare will continue for 93 months, which is about 7.5 years, following the 9-month trial work period. So even if they're not receiving a check because they're earning over $1,070, the Medicare is continuing. Moving on to the next slide, we're continuing the Social Security Disability Work Incentives. The fourth item is expedited reinstatement. So this comes into play if your client has worked their 9-month trial work period and they have worked throughout that 36-month extended period of eligibility and the benefits have terminated. Well, this expedited reinstatement allows an individual to get right back on benefits if they refile within 5 years of their benefits terminating. And of course, to be eligible, they have to not be working substantially and have to have a similar or the same disability that they were awarded for previously. And the benefit of this expedited reinstatement is that they can immediately start getting their checks. We can pay them for 6 months while the medical decision is being made. They don't have to wait for that medical decision to come in. The fifth item there is work expenses related to your disability. And we call those impairment-related work expenses. If you have somebody working and they're just barely earning over $1,070, maybe they're making $1,500 a month, if they have out-of-pocket expenses related to their disability that they're having to pay just in order to work, then those can be deducted or subtracted from their earnings in determining whether they're working substantially. And the example given there is you need a taxi to work because of your medical condition, you can't take public transit, or counseling services. The most common impairment-related work expense that I see us approve is prescriptions. You know, not all prescriptions are covered by the insurance that might be available. So if an individual is having to pay, you know, a couple of $100s in co-pays each month, that can be deducted, and Austin can help. The next slide is a calendar example of what I've just discussed, just to kind of reiterate, give a visual of this. And the example here is that an individual went to work in April of last year, of 2013, and they started earning over $770 gross a month. So April through December was their 9-month trial work period. And then in January of 2014, their EPE, or extended period of eligibility, began. And from January of 2014 through December of 2016 is their 36-month EPE, or extended period of eligibility, in which if they're earning $1,070 gross or less, then they get their full check. If they're earning over $1,070, then they would not get their check. And it could go on and off that way during that whole period, so all the calendar months that you see there. If they were still working substantially as of January of 2017, the benefits would terminate. And that's where the expedited reinstatement would come into play. So I'm sure that there are questions about that. I guess what I'll do is just go ahead and complete the entire PowerPoint, and then we'll take the questions at that point. As I'm about to move, the next slide moves us on to SSI. So
Mandy?
Yes.
I just want to interrupt for just a second. There haven't been any questions asked at this point in time, so I just want to remind everybody, we do have 45 persons on this call, so if you have a question, there is a box over to the right under the webinar menu, and so you can plug in your question right there, and we will get it to Mandy. So just wanted to say that again, but go ahead. I'll move on to the next slide for you.
Thank you, Chris. Okay, the next slide is Supplemental Security Income Disability Work Incentives. And so now we're on to SSI, those checks that come on the first day of the month based on need. And the answers are quite different here. How work affects SSI is very different. The first item is income exclusions. SSI counts less than half of an individual's earnings. And the example is if they make $885 in gross wages, only $400 of that is considered countable income and would be the amount that would reduce the SSI check. And by the way, I haven't mentioned specifically, but both programs count the gross wages before any deductions, before the taxes are taken out. And SSI counts the wages based on when they're paid, on the paydays. Social Security counts wages based on when it's earned. So it's a little bit different. I just wanted to highlight that. Well, the second item on this PowerPoint is Medicaid continuation. And the Medicaid will continue even if an individual's earnings are so high that the SSI payment stops, unless they start earning over the state's threshold. And this threshold does change each year, and it is different per state. In Texas, for this year, the threshold is $33,407. So if an individual is working and earning a lot of money, the Medicaid can still continue as long as they don't go over this threshold if they need Medicaid in order to work. And they will be asked that question. You know, there's a few questions related to the continuation. And if you're wanting to make notes or you're having any problem with a client, this Medicaid continuation provision is called 1619B. B as in boy, 1619B. That's what the provision is. If you needed to talk with somebody at Social Security and had any problems, you could mention that and kind of get going in the right direction. The third item is student earned income exclusion. If you have a client who's under the age of 22 and regularly attending school, then $1,750 a month of their earnings can be excluded, up to a maximum of $7,060 a year. And what it means by regularly attending is very lenient, and it includes more than just high school. It can be college or university. It can be a trade school. And to give you an example of that, if they're in high school, they have to be attending for at least 12 hours a week. If it's college or university, at least 8 hours a week. And if it's a training program, it's 15 hours a week if there's shop involved, or 12 hours if no shop. So that's just a very quick overview of that. And then blind work expenses. SSI also has just regular impairment-related work expenses that can be deducted just like Social Security does. If an individual has out-of-pocket medical expenses related to their disability or any expense related to their disability that they have to pay in order to work, it can be excluded. SSI, though, has this additional exclusion for blind individuals where virtually any and every expense related to going to work can be deducted for blind individuals. So that's a little bit different. All right, moving to the next slide. Still on SSI, you see expedited reinstatement, just like we saw with Social Security disability. If an individual, that the SSI gets terminated, they can file within 5 years if they're not working substantially and they have a similar or the same disability that they had previously. Number 6, of course, is work expenses that I jumped to ahead of blind work expenses, just like we saw with Social Security. And then number 7, report wages monthly to prevent SSI overpayments. And with SSI, an individual's earnings affect that SSI check. So that the SSI check can fluctuate every single month based on that person's earnings. So it's very important to advise them to report for SSI monthly. Now, they need to report for both programs the minute they go to work. They need to call the 1-800 number and report that they're working. Or they can call their local office, but we do encourage the 1-800 number as the first contact. With Social Security, if they report and say, I'm making this amount of money on a monthly basis and that doesn't change, then they don't need to call back and change that. It's only if their work changes. SSI, same answer, but any fluctuation could affect the SSI. So the next slide is an example of how earnings affect the SSI payment. And this may be more detailed than you want, so I'm going to go over it real quick. If it's too complicated, you don't need to worry about it. The example is the individual works and earns $885 in a month, gross wages based on the payday, and they don't have any other income. What we do is we would take the wages, $85 would come off the top of that, leaving $800. We only count 1/2 of the remainder, so we divide that in half, and that leaves $400 in countable income. And that's what is subtracted from the maximum SSI payment of $721, leaving an SSI check of $321. So some individuals would say, well, I don't want my SSI check going down. I was getting $721, now I'm only getting $321. But if you look at the wages that they're earning and add that together, they always come out with more income. So in this example, the reduced SSI check of $321 plus their wages is about $1,206. So they're coming out with more money even though their SSI check is reduced. Moving on to the next slide is how to report. SSI telephone wage reporting is one option. Before an individual can use this telephone wage reporting option, they do have to have contacted either our 1-800 number or their local office to report that they are working. That has to be in the system. Once it is, then they can call this number, which is a different number, the 866-772-0953. It's specifically for telephone wage reporting. And we recommend that they call the first 6 days, the first week of each month. They don't have to. The process will work any day of the month, but you do want to report early in the month to make sure and catch the next month's SSI check. They'd be reporting what they were paid in the prior month and reporting their gross wages. Moving on to the next slide is SSI mobile wage reporting. If they have a smartphone, then they can download an SSI mobile wage reporting app, and it's free, and they can report using their smartphone instead of calling. So that's certainly an option. On to the next slide is just a reminder that the fastest way to verify Social Security SSI is by going to our website, to My Social Security, to get their benefit verification letter immediately online where they can print it out. The next slide is My Social Security Services, just an outline of what's available. If you don't get benefits, you can view, save, or print your Social Security statement, looking at all of your earnings over your lifetime and an estimate of your benefits and your taxes paid. If you do get benefits, you can get, as we mentioned, that benefit verification letter. You can check your benefit and payment information and your earnings record. You can change your address and phone number, and you can start or change direct deposit. And, of course, there are some restrictions for individuals getting SSI. So keep that in mind with address changes and direct deposit changes. Moving on to the next two slides, it's just a visual of how to go in to create a My Social Security account. And I'm not going to go into the details of it. I just wanted you to see it, kind of what happens when you click on My Social Security, that little lock. And then the next option is to create an account. And the next slide kind of shows the information it's going to ask. And I would encourage all of you to go in and create an account for yourself, to go in there and do that today. That's really one of the best ways to secure your information. Most of the feedback I receive is individuals not wanting to put their information out there. Well, the recommendation is to go in and create your account so it's password and information word protected based on information that only you know, so that nobody can go in and try to create a record using your information. So I would encourage you all to go in and create your own account. That way when your client needs help, you will be familiar with it and can help them. And those are all the slides. I think there are a few more, but I'm not going to touch anything else on that PowerPoint because those are the basics I wanted to go over. So Chris, any questions that you have or that have been sent in?
Sorry about that. I have to take myself off mute before I start talking. Can you hear me, Mandy?
I have.
We had one question.
I sure can, yes.
Okay, we had one question, I believe it was about SSI, and that was, can an ex-spouse collect work credit if the spouse is married again? So
repeat that for me, Chris. Say that one more time.
I believe it's asking, the wording was, can an ex-spouse collect work credit if the spouse is married again? So perhaps it's about...
I think maybe the question is, if an individual is divorced, and they're wanting to collect benefits on their ex-spouse's record, but that ex-spouse is remarried, can that individual still file? And the answer is yes, if they were married for that 10-year duration and they haven't already remarried.
Okay. Okay. So if they're married for that.
Hopefully that's answering that question.
Okay. So if they're married but yet they. Okay. And if that didn't answer that question adequately, go ahead and respond. I believe that was Jay. And the other questions were just asking about the hotline number for reporting wage, I guess, wage reporting, and then just getting a copy of the PowerPoint. So what slide was the phone number on for the wage reporting?
Slide 27.
Okay.
Is the SSI telephone wage reporting.
Okay.
And slide 28 is the SSI mobile wage reporting.
And how did that? Did the mobile wage reporting just start, or how long has that been around?
Oh, great question. I would have to look that up. It has not been around long. I would say over the last year and a half.
Okay. Yeah, it's the first time I've heard about it.
Yeah, it's relatively new. So.
Well, great.
And the only trick to either the SSI telephone wage reporting or the SSI mobile wage reporting is that we have to know that you're working before you can use these processes. So they still have to call the 1-800 number or the local office first, report that they're working, let us put that on their record. Then every month thereafter they can use this telephone wage reporting or mobile wage reporting.
Okay, great.
Okay.
So they can report on it every month. And can I send out a copy of this presentation? A couple people are asking about getting copies of the presentation.
Yes, absolutely. All this information is just pulling directly from our website, so there's nothing private in it.
Great. And then I was going to look up, getting back to the website. Well, I think that's it. I mean, everybody seems pretty satisfied with the information you gave.
Okay.
Well, Mandy, thank you so much for, first of all, for being here online today and talking about all these supports. Second of all, thank you so much for all the help you've given us, especially when we're working with clients in the Central Texas area and helping us work with those clients more effectively and being able to figure out if they're on disability or not, or how we can help them the best.
Right.
So
I'm glad to help.
Yeah, I wanted to just thank you for everything you've taught us here, and we are going to keep leaning on you to get more information. And I will send out the PowerPoint to everybody. And if anybody has any questions, I will try to answer them as best as possible. If not, I will refer them back to you, Mandy. So I just want to say thanks. And for everybody else that is online and listening, we will be having our next Bloc talk at the end of June. It looks like we're headed for June 24th in the afternoon. And it looks like we might be speaking more around, or having a discussion more around HMIS and how case managers can use HMIS systems to keep and to get more information or collect more information about their clients. So thanks for everybody for being here. And Mandy, once again, thank you so much for the presentation.
You're welcome. You'll have a good day.
All right, you too. Bye.
Bye-bye.